For the next performance evidence observation checklists, students are required to implement and monitor at least 2 different nursing care plans whilst they're on their aged care placement. We also ask that you evaluate the outcomes of the care plans and recommendations on the care plans. See here, this is the first care plan in this column and then the second one here. Because at times it's difficult accessing the resident's electronic medical record where their care plan is situated, and also because the care plan is quite complex, we encourage students to refer to the care plan template that they have access through Cluster 1 Assessment Task 15. On the screen you can see this is Cluster 1 AT15, so at the top of the screen, so the case study. So if you just scroll down the page, there's actually a really good template, a nursing care template that you can use for this particular performance evidence checklist. So it's very much a standard template that you're all familiar with because we use these in the sim lab all the time. So the diagnosis can be a named diagnosis, but it might be one that you've just developed whilst you're working with your buddy or with a facilitator. It's something you've identified as a concern. And then setting some goals for the resident, including subjective or objective data, as well as the possible nursing interventions and the rationale for why you recommend those nursing interventions. It could be something as simple as a diagnosis of incontinence. That person's at risk for a pressure injury. So obviously the goal would be no pressure injury. And then we would look at objective data like skin assessments, as well as checking for new pressure injuries. And then our particular interventions we may decide to do are things as simple as pressure area care, frequent toileting to make sure that the resident is dry and not at risk of developing new pressure injuries. So we highly recommend that you get a copy of this care plan to take with you whilst on placement, and you can use that for this performance evidence checklist. So in the checklist, it basically is asking why would the person benefit from having a care plan. We want you to use appropriate clinician language when you're writing the care plan, so making sure that you're using correct medical terminology. We also want you to prioritise the key issues for the resident. What's the main problem or main concern here? And make any adjustments that might be required in accordance with existing recommendations, so things that need to change. We suggest that you bring your care plan with you when you have your debriefing sessions and go through them with the clinical facilitator. It's a really good opportunity to discuss plans of care for your residents. You can also be going through discussing the recommendations that you're coming up with your buddy whilst you're working with the residents. I guess the most important element to this particular checklist is about linking your theory back to practice. So why do we develop care plans? When you're looking after your residents, it's because you want to see an improvement in their quality of life or their activities of daily living. So, it's linking it back. We are setting these goals and objectives and interventions to improve their quality of life. So we want you to be putting that into practice. As with all the checklists, we also have the final supervisor feedback and then an opportunity for the students to respond.